Hi everyone.
Hi.
It gives me great pleasure to be joined by Dr. Catherine Casey today. Catherine is working at the Camden Holistic Clinic and she is a general practitioner, a medical doctor and an integrative doctor. And it's been wonderful having her with us, and her interest is really in combining the best of both worlds with conventional medicine, complementary medicine, so we get a truly holistic approach. So Catherine, tell us, why did you become interested in integrative medicine?
I sort of had a pretty complicated journey. I started having a lot of medical issues in my sort of mid to early 20s. I had like a big flare-up of autoimmune disease, which later turned out to be psoriasis and psoriatic arthritis. But I initially had a real confusing time because no specialist could work out what was going on. I had lots of dermatological issues. I had a lot of fatigue. I always was someone who was very food sensitive and had a lot of upper respiratory tract infections and tonsillitis, ear, nose and throat issues.
Right.
As a young child, lots of tummy issues. And they sort of settled down. I was mostly pretty healthy. I ate pretty well. But by the time I got to uni, I was away a lot. I was going out for meals. I started drinking a bit of alcohol. And all those things are really a disaster for your gut health.
Yeah.
And unfortunately, I started to develop the problems that I was probably genetically predisposed to having. Both my parents having had psoriasis and eczema.
Oh, both parents. Yeah, that's a strong
double
gene.
whammy.
Yeah.
So
Right.
I basically ended up having issues with my joints and lots of fatigue and lots of sleep problems. And I didn't really get a lot of solutions from the specialists that I consulted. I was basically given pain medication and told that there was nothing I could do from a diet or a lifestyle point of view to fix my issues. So given that
You became your own physician.
given that I'm a relentless researcher.
And you weren't even at medical school then.
By the time these problems evolved, I was sort of getting through there, and then I was a
Yeah.
junior doctor, because this is all autoimmune disease. It can unfold over a long period of time. Some people have a
Yes.
very, very quick onset. I had a really gradual, really irregular onset, which is probably one of the reasons why it was hard to diagnose what was
Yes.
going on.
Insidious, yeah.
Yeah, unfortunately. And I sort of ended up doing quite a lot of research and learning about things, and I was always interested in food. I was always really, trying to be active, trying to be healthy, trying to figure out what is a good diet, what's a healthy diet, exercising, that sort of stuff, and that sort of kept my eyes open to the possibilities. And it just sort of turns out that there are actually a lot of people out there, doctors, naturopaths, and other sort of medical staff that have a really good idea of how to fix these problems by basically changing your diet, fixing your gut.
Yes.
So fast forward to now, and I'm off medication. I don't take any pain medication. I pretty much don't have any gut issues, and my psoriatic arthritis, chronic fatigue, fibromyalgia, and thyroid issues are basically under control. So I'm really happy with that, rather than being on immunosuppression.
Yes. Well, when you're young and you get a diagnosis of autoimmune disease, it's overwhelming, particularly if you're told you need to take immunosuppressants for the rest of your life, because you're looking at 50 years of taking a drug that has got some potentially severe side effects. So it's good to look at other options which are safer in the long term, and as you found, were very effective so that you didn't need the drugs. It's not to say that you'll never need them, but while you've got it under control with diet and supplementation, that's fantastic.
Absolutely.
Yeah, and so it's good to work on yourself. We work on patients, but when the doctor has a problem and it's physician heal thyself, it's like your own little clinical trial, isn't it?
Yeah, I mean, I think with things that don't have any negative sort of side effects, it's pretty reasonable to do an experiment and just try making a few changes here and there. Sometimes supplements are really, really super helpful, and can be wonderful additions that can make a tremendous difference. Basically I was pretty happy with changing my diet and seeing how that went, and it really went wonderfully for me. So
yes. How long did it take, to really help your immune system?
Actually, I got a really big improvement in a lot of my pain within about 4 days of getting rid of certain vegetables. Yeah, so I was, without knowing it,
4 days?
A big improvement.
I always say to patients, you've got a chronic illness, So try this diet, try these supplements, and sometimes we have to use hormones as well. And in 4 months, you're going to feel a lot better, generally speaking, because nutritional medicine can take 3 to 4 months.
Yeah.
But that is amazing.
Yeah, I was pretty pleased. I knew that I was going in the right direction because everything in my body started functioning better. I started having more energy. I felt less, I guess, tight and stiff, and definitely a lot less sore, less inflammation. Yeah, the difference was very, very quick. So once I got the right sort of information and I was trying the right things, because I tried lots and lots of things and they just did not work. So I think that it's a really important, crucial component to get the right information. And there are so many different diet options now that, you know, it depends on what kind of issue you have. So I would suggest a certain type of diet for someone with autoimmune disease that I wouldn't necessarily suggest for someone who wanted longevity and had no gut issues.
Yeah.
So navigating through all those different options, luckily I found the right one for autoimmunity and made a huge difference. And then my recovery has been a gradual one, unfortunately, in lots of ways. So I did have a big initial improvement. It took me another few months to get off pain medication. Yeah, and to get my gut, you know, right, it took about 3 months overall to get a really, really good improvement. And then
that's good. 3 months. Yeah.
With certain things like my nails, because I had quite bad psoriatic nail disease, it took me a couple of years to figure out how to get the gut just right to basically get my nails back to normal.
Yeah, well, that's the important thing, is to individualise a program for someone.
Yeah, definitely.
Because, you know, people go on the internet and they see so much conflicting information.
Oh yeah.
Particularly cancer patients, and they get very confused, and it's more overwhelming than if they just stuck to one thing. So, you know, you really need guidance, and it needs to be tailor-made for you, because we all have different genes, we all have a different gut microbiome, we all have different hormones, and, you know, it's very important to do the right tests, isn't it?
Absolutely, yeah. So I think that probably what I went through was a blessing, because it's allowed me to sort of understand things from, you know, the point of view of someone who's unwell and potentially facing disability. Like with my chronic fatigue, I was basically unable to work for about 6 months. I was very unwell. And going through, you know, the experience of seeing specialists and seeing GPs and getting things tested and checked, and the information that I was given that wasn't accurate, and various, you know, components of that journey, it sort of really has given me an insight into what it's like to be chronically sick, and, you know, how to kind of deal with that from a patient point of view. So I'm actually in a way thankful that I went through that, because it's sort of given me skills that I wouldn't otherwise have learnt in medical school.
Yes.
Yeah, unfortunately.
We do a lot of educating after we graduate.
Yeah.
Self-education and research, you know, it never stops. It's a lifelong passion. And we're always learning, and patients teach us so much, don't they?
Absolutely.
Yeah, they really do, if you listen to the patient. And we might wind it up here, and then we're going to do another short video on some autoimmune diseases. So thanks, Catherine, and thanks for listening, everyone.
Thank you, Sandra.